Hi, I'm Brooke Lilly, and this is my presentation on coronary artery disease. Coronary artery disease occurs when the coronary arteries, which supply blood to the heart, become narrowed or blocked due to the buildup of plaque. This buildup is known as atherosclerosis and can lead to serious complications such as heart attacks. Now, understanding the CAD is crucial because it's the leading cause of heart-related illnesses and deaths worldwide. However, with early detection, lifestyle modification, and medical intervention, it can be managed effectively. Now, in this presentation, we are going to explore the causes, symptoms, diagnosis, treatment options, and preventive strategies for a CAD. Now, the pathophysiology of a CAD is going to start with a fatty streak. Now, this is the hallmark of the pathophysiology. So a CAD is an atherosclerosic plaque formation. Now, this plaque buildup is of fatty material that is going to narrow the arterial lumen that is going to impede the blood flow. The first step of this process is going to be that fatty streak formation. Now, the collagen will cover the fatty streak and the vessel lumen is going to be narrowed, which leads to blood flow reduction. Now, because of this, fissures can develop. Now, when these fissures develop, a complete lesion or a plaque rupture will create a thrombus, which is going to further narrow or totally occlude the vessel of the heart. Now, this can lead to a low level of oxygen, myocardial ischemia, or even an infarction. Now, let's talk about the primary cause of CAD, which is atherosclerosis. Now, this obviously occurs when that fatty deposits, such as cholesterol or other buildups of substances, are going to be inside the artery walls, which is going to restrict the blood flow to the heart. Now, in addition to the plaque buildup, inflammation can also play a role in damaging the arteries, leading to further narrowing. Now, there are going to be two types of risk factors associated with a CAD: modifiable and non-modifiable. Now, modifiable risk factors include smoking, high blood pressure, high cholesterol, obesity, diabetes, and a sedentary lifestyle. Now, these are factors that individuals can control or change through lifestyle choices and medical treatment. Now, our non-modifiable risk factors, which are going to be risk factors that we can change. Non-modifiable risk factors are factors that we cannot change, and that is going to include our age, genetics, and gender. Now, older individuals and people with a family history of heart disease and men are actually at higher risk for developing a CAD. Now, although we cannot change our non-modifiable risk factors, focusing on reducing the modifiable risk factors can significantly lower the changes and chances of developing a CAD. Now, our coronary artery disease can be present with a variety of symptoms. Now, some of which may be mild or even unnoticed until a serious event such as a heart attack occurs. Now, one of the most common symptoms of a CAD is chest pain, which is usually the first sign, also known as angina. Now, this pain can feel like pressures, squeezing, heaviness, or a burning in the chest, and it may even spread to the arms, neck, jaw, back, or stomach. Shortness of breath is going to be another common symptom that occurs when the heart cannot pump enough oxygen-rich blood to meet the body's demands. Now, some individuals experience fatigue, dizziness, or nausea, particularly during physical activity or stress. In severe cases, a CAD can lead to a heart attack, which requires obviously immediate medical attention. Now, symptoms of a heart attack can include severe chest pain, shortness of breath, sweating, nausea, and lightheadedness. Now, recognizing these symptoms early and seeking medical attention can prevent complications and improve outcomes. Now, diagnosing a CAD involves several tests that can help assess the condition of the coronary arteries and overall function. So an electrocardiogram, ECG, is a simple test that records the electrical activity of the heart to detect abnormal rhythms or previous heart damage. Now, also, a stress test can involve monitoring the heart's activity during physical exertion to identify any potential issues with blood flow. Now, a coronary angiography is going to be a specialized procedure that involves injecting contrast dye into the blood vessels that cause it to light up and take X-ray images to identify any blockages in the coronary arteries. Now, a CT coronary angiogram is a non-invasive imaging test that provides detailed images of the heart's blood vessels. Now, our blood tests are also going to be important as they can detect high cholesterol levels, inflammation markers, and other risk factors that may contribute to CAD. Now, based on these diagnostic results, doctors can determine the severity of a CAD and recommend appropriate treatment options. So what are those treatment options going to be? Now, our treatment for CAD depends on the severity of the condition and the overall health of the patient. Now, obviously, our goal of the treatment is going to be improving blood flow to the heart and reducing the risk of complications such as heart attacks. So our first line of defense is going to be our lifestyle modifications. A heart-healthy diet that is low in saturated fats and high in fiber can help reduce cholesterol levels. Regular exercise can obviously strengthen the heart and improve circulation. Now, quitting smoking and managing stress are also crucial steps in preventing disease progression. Our next line of defense, our medications, can be described to obviously manage symptoms and reduce the risk factors. Now, statins can help lower cholesterol levels. Aspirin, like a baby aspirin, can prevent blood clot formation, and beta blockers will reduce the heart's workload by slowing the heart rate and lowering blood pressure. In our more severe cases, medical procedures may be necessary. Now, an angioplasty and stent placement involve inserting a small balloon into the artery to widen the blockage and then placing a stent to keep it open. Now, for patients with extensive blockages, a CABG is required, a coronary artery bypass graft. Now, this procedure creates a bypass around blocked arteries using a blood vessel from another part of the body to increase blood flow to the heart. Now, these treatment plans should be tailored to each individual based on their specific needs and risk factors. Now, if left untreated, an acute coronary syndrome can happen, which I will go into more detail in the next slide. An MI can happen when blood clots completely and block the coronary artery, which leads to a damaged heart. Our heart failure, obviously our heart weakens and can't pump blood effectively. It can create arrhythmias, which is irregular heartbeats, and a cardiac arrest, which is complete loss of heart function. And it could also, and your heart can also go into a cardiogenic shock, which is where blood cannot be pumped enough to meet the body's needs. Like I said, one of these risk factors for a CAD can be the acute coronary syndrome. So a little patho behind this is obviously our coronary artery disease is going to lead to an acute coronary syndrome. Now, based on the severity on the amount of oxygen lost or blocked, the coronary artery can become ischemic within 10 seconds to 20 minutes. And that can lead to infection or a muscle death. Now, an unrelieved ischemia can result in myocardial necrosis. So our ACS includes unstable angina, non-ST elevation MI, or an ST elevation MI, which is extremely bad. And we can diagnose this by our ECG. Now, prevention is going to be key for reducing your risk of a CAD. That is maintaining a heart-healthy lifestyle, eating a balanced diet, exercising regularly, managing your stress, and monitoring your blood pressure and your cortisol, your cholesterol levels. Also going to the doctor and maintaining a regularly checkup is key in avoiding a CAD. Now, if we were paying attention throughout this presentation, we should be able to answer these easy callback questions. Now, what symptom is usually the first of a CAD? That is going to be angina or chest pain. What is primarily the cause of CAD, which is our atherosclerosis, and what type of medication should a person with a CAD take? That would be our statins, such as arteriostat. Now, here are the references that I use during this presentation. Thank you so much.